Good morning. My topic for presentation is polypoidal choroidal vasculopathy in the young. It was first described by Januzzi in 1982 and is found to be more common above 60 years of age. The average age in Indian population is 61 years with a male predominance. So there's paucity of literature regarding its manifestation in younger patients, and the current body of evidence is limited to isolated case reports and a small case series, thus creating a significant knowledge gap in understanding the disease in the younger demographic. So our primary aim is to study the demographic features, clinical presentation, multimodal imaging characteristics in individuals under 50 years of age, and to see if this phenotype is different and compare the features with that over 50 years of age. So it's a retrospective observational study. Electronic medical records of 1100 diagnosed cases of PCV were analyzed, and we found 56 patients. So patients who showed features of PCV such as elevated orangish nodules, submacular hemorrhage, serosanguinous PEDs, and lipid exudation out of proportion to the lesion had comprehensive ophthalmic evaluation, including BCVA, slit lamp, and fundus examination. And they also underwent multimodal imaging like color fundus photo, OCT, FFA, and ICGA. So we included patients aged less than 50 years, cases with subretinal and sub-RPE hemorrhage on OCT who did not have ICG, and no characteristic OCT markers were excluded from the study. 8 patients were excluded from our study because 1 patient had a CNVM scar with active polypoidal lesions. 7 patients had dense submacular hemorrhage without any ICG or OCT. So only 48 patients were eligible for the study. We found a prevalence of 4.36% of young PCV in 1100 diagnosed cases of PCV. The mean age was found to be 44.73 years, and the youngest patient in our series is 32 years old. 66% of them were females. So a small example of a 32-year-old female who complained of blurred vision in right eye with associated metamorphopsia. She was diagnosed as retinitis with inflammatory CNVM elsewhere. She took a course of oral steroids and 4 doses of intravitreal ranibizumab injection with no improvement. She presented to us with best corrected visual acuity of 6.9 and 6. Fundus examination of the right eye showed a coin-shaped lesion. OCT showed a peaked PED with SMD. FFA, in FFA we can see a hyperfluorescent lesion at the macula. In ICG there's a nodular hyperfluorescent lesion with surrounding hyperfluorescence suggestive of ICG. She subsequently received treatment with aflibercept and had improved. So mean visual acuity at presentation was 0.46 logMAR units, which is nearly 6/18, and at last presentation it is 0.39 logMAR units, which is roughly 6/12. The p-value was not significant. So 60% of the patients in our study had a hemorrhagic presentation. The lesions were subfoveal in 77% of the cases. And in this ICG picture, we can see a cluster of polypoidal lesions subfoveally. And this is another, first picture shows an aneurysmal network which is ending in polypoidal lesions. So in ICG, 67% of the patients had predominantly polypoidal lesions, and 32% of the patients had abnormal neovascular network. So another example of a 46-year-old female, her vision was good, but she had complained of metamorphopsia. Examination showed a small subfoveal PED. We had managed her conservatively, and she presented 1 year later with diminished vision and metamorphopsia. Her vision at this presentation was 6.9 and 8. Fundus examination showed multiple yellow discrete lesions around the fovea. OCT showed an SMD, irregular RPE, which was ending in a peaked PED. ICG showed an abnormal neovascular network subfoveally, which was ending in polypoidal lesions. We again diagnosed her as PCV, and in this picture we can see how well the polypoidal lesions have resolved after injections, and with only residual branching neovascular network. So in the hemorrhagic group, branching neovascular network was seen in 13 patients, and 21 patients had single to multiple polypoidal lesions, whereas in the exudative group, 6 patients had a branching neovascular network and 13 patients had single to multiple polypoidal lesions. The mean choroidal thickness in the PCV eye was 355 microns. The other eye, it was 348 microns, and hemorrhagic PED was seen in 53% of the cases, followed by fibrovascular PED in 37% of the cases. So we highlighted the differences between younger age group and older age group. In our study, we found a female predominance with a male is to female ratio of 1 is to 2, and a majority of the patients in our study had an hemorrhagic presentation, and 67% of the patients had predominantly polypoidal lesions on ICGA, and which explains the high incidence of submacular hemorrhage, since these polypoidal lesions tend to rupture and cause hemorrhage. So bilateral involvement was seen in 8 patients. Fellow eyes had a macular scar in 5 patients. The macular scar could be due to long-standing submacular hemorrhage or serous macular detachment secondary to PCV, resulting in scar. So to conclude, unlike ARMD, PCV can be seen in the very young, and the features differ from those seen in the elderly. This phenotype is characterized by hemorrhagic presentation. It's predominantly polypoidal in ICGA, located subfoveal, and is always associated with a thick choroid. So it should be considered an important differential diagnosis in patients less than 50 years of age who are presenting with submacular hemorrhage or exudative maculopathy. So the strength of the study is, to the best of our knowledge, this is the only study till date which has looked into such a large number of patients, but the limitation is it's a retrospective study. So these are just the...
No, okay, thank you. No
Thank you,
questions.
sir.